My name is Jason Long. I'm a thoracic surgeon here at the University of North Carolina. I'm an assistant professor of surgery. I became a doctor mostly to help people. And I've had different answers during different parts of my career in training and now, in practice. But, I think the main reason I want to be a doctor is just to help people, but also to apply and use some of the skills that I have. And I've always enjoyed working with my hands, but I've also always enjoyed laughing with patients and having a good time. But also helping those that are not having such a good time. So, I thought about several different specialties, but I think thoracic surgery almost chose me and I chose it. And from the first day I stepped into the thoracic surgery operating room in my residency, I was enamored. That was what I wanted to do. I knew it. I enjoyed all the organs in the chest. I thought it was clean and neat and precise, and I loved how incredibly important they are. They're vital organs, and so I was always taken to that. The thoracic surgeon means several different things in different places, but what I concentrate on is general thoracic surgery, so that's anything but cardiac. And so that's any operation in the chest involving the lungs, the esophagus, or the mediastinum. So we operate on lung cancer, we operate on infections in the chest, on esophageal cancer, but we also do lung transplant. And we participate in some trauma cases as well. So that's one of the main reasons I chose thoracic surgery is because of the wide variety of cases and different things that may come in through the door. So robotic surgery is just another way to do minimally invasive surgery or surgery through small incisions. And the advantage to small incisions is that folks recover faster. There's not a large incision on the side of their chest, and they have less blood loss, less complications, can go home sooner and be with their families. But I was also trained in robotics towards the end of my fellowship. That's when it became more popular in thoracic surgery. And I really saw an advantage to that over the other modes of operating, because the robot essentially is computerized arms with special hinges and movements that can do all these degrees of motion that stick-like instruments can't do. And so that enables you to get in and do an operation, one, with more ease, but also with more skill and better vision. I think one of the advantages of robotic surgery is that you have less pain, potentially less complications, less bleeding, and a shorter length of stay. So we're always in pursuit of trying to get our patients home sooner and safer. I treat every single patient like a family member or a best friend, and so I don't necessarily believe in being part of the professional stale relationship that may exist in some doctor-patient relationships. I believe in being friendly and not being entirely formal all the time. I think talking to a patient like a family member or a friend at times is needed, especially when the news may not be what they want to hear. Full conversation about the risks and benefits of an operation are important. So I believe very strongly in informed consent and alternatives to the procedure and the risks. I think everyone needs to know those before getting into an operation. I chose UNC to be closer to home. This is where I'm from. I actually went to college here, and I drive by my dormitory for my freshman year every single morning, which is strange. But I've always enjoyed UNC because of the collegial atmosphere. There's a lot of research here, but folks are also very nice and want to work together across disciplines. And I think multidisciplinary care is the way to really help folks.